Taping for tibialis posterior activation. So let's look at the anatomy. The tibialis posterior attaches from the posterior shaft of the tibia, and it's quite proximal to the top of the tibia and also very deep underneath gastroc and soleus. It comes down towards the medial side of the ankle and attaches into the navicular, the cuneiform, and the bases of the second to fourth metatarsal, so it spans underneath the plantar area of the foot. And this muscle is a big foot inverter and also helps with plantar flexion of the ankle. As it spans right underneath the plantar part of the foot, it's quite important in terms of ankle and foot stability. An interesting thing about this muscle in particular is it isometrically contracts when the foot is loaded on the ground. So the muscle becomes stiffer when it's loaded against impact forces. So think about your runners, your jumpers, anyone that's loading continuously and absorbing impact forces from the ground need a good strong tibialis posterior. So why activate the tibialis posterior? As I mentioned previously, this muscle is a really important muscle for how we absorb impact forces from the ground when we are walking, running, and jumping. So therefore, it's really important that we can build strength and activate this muscle when needed. As we impact the ground, we are looking for an inversion of the subtalar joint, which then means that the tibialis posterior is isometrically contracted, which means as we load into the ground, we can load the impact forces into the lower leg through that stiffness, creating a more stable base. If you've been working with patients that are runners or jumping a lot and they've been experiencing pain or dysfunction in the ankle, knee, and hip, then assess the tibialis posterior to ensure that they can load those impact forces from the ground within a stable base. As with everything that we do, always assess first and don't assume anything. And if you know that tibialis posterior is a muscle that you need to activate with your patient, then use this kinesiology taping as part of that integrated plan to build strength within that muscle. This taping is a one-step taping, which is just activation of the tibialis posterior muscle. Other taping considerations to think about is activation for any of the peroneal muscle group, tibialis anterior, gastrocnemius, or soleus. And the reason you may want to think about these muscles is that if you're trying to improve inversion of the subtalar joint, then it may not just be the tibialis posterior that needs activated to try and improve that stiffness when your patient impacts the ground. But as with everything, always assess before you treat. With your patient lying on their side to expose the medial side of the lower leg, break off the tape at the anchor and attach the anchor onto the medial side of the lower leg. Then ask your client to go into eversion and dorsiflexion to create a stretch on the tibialis posterior, and with a light tension on the tape, place the tape along the line of where the tibialis posterior is and relax the foot to attach the anchor. And with a slightly longer piece of tape, you can take the anchor right underneath the plantar part of the foot.